What is endometriosis? Explained for fertility patients. Endometriosis is a chronic condition where tissue similar to the lining of the uterus grows outside of it. This tissue can be found on the ovaries, fallopian tubes, and the lining of the abdominal cavity. Each month, this misplaced tissue thickens, breaks down, and bleeds during the menstrual cycle. However, since it has no way to exit the body, it leads to inflammation, pain, and sometimes the formation of scar tissue, known as adhesions. For those concerned about fertility, endometriosis is significant because it is linked to an increased risk of infertility. While about 5 to 10% of women have endometriosis, it is found in 30 to 40% of women who are experiencing infertility. This highlights a strong connection between the condition and challenges in conceiving. Endometriosis can affect fertility in several ways. First, in moderate to severe cases, it can cause scar tissue that distorts the pelvic anatomy. This distortion may block or impair the fallopian tubes, preventing the egg and sperm from meeting or stopping the fertilized egg from reaching the uterus. Additionally, endometriosis can form cysts on the ovaries, known as endometriomas. If these cysts are surgically removed multiple times, it can reduce the number of eggs available, potentially lowering fertility. Chronic inflammation from endometriosis may also impact the function of the fallopian tubes, egg quality, sperm function, or the environment necessary for implantation. While the exact mechanisms are still being researched, these effects can complicate the ability to conceive. Hormonal and immune changes in the pelvis and uterus may also interfere with ovulation, fertilization, or implantation, although these effects are not fully proven. Diagnosing endometriosis typically requires a surgical procedure called laparoscopy. This involves inserting a small camera into the abdomen to visualize and sometimes biopsy the endometriotic lesions. Symptoms such as painful periods, painful intercourse, and pelvic pain may raise suspicion, but they cannot confirm the diagnosis without surgery. When it comes to treatment, surgical options can improve fertility outcomes for women with moderate to severe endometriosis. Surgery aims to remove endometriotic lesions and adhesions, helping restore normal pelvic anatomy. However, surgery carries risks, including potential damage to ovarian tissue. Medical therapies that suppress endometriosis symptoms do not improve fertility and may delay more effective fertility treatments. For women over 35 or those with severe endometriosis, assisted reproductive technologies like in vitro fertilization may be recommended, especially if surgery does not lead to pregnancy within 6 months. Because endometriosis can worsen over time, healthcare providers often advise not delaying attempts to conceive once diagnosed. In summary, endometriosis is a complex condition that can impair fertility through various mechanisms, primarily by causing pelvic adhesions and ovarian cysts that disrupt normal reproductive processes. While many women with mild endometriosis can conceive naturally, those with more advanced disease may need surgical or assisted reproductive interventions. It is essential for individuals to work with fertility specialists to create personalized treatment plans that balance symptom management with fertility goals.